Have you ever found yourself pausing mid-conversation with your elderly loved one, sensing a subtle shift in their energy or demeanor, and wondered if these changes might mean something deeper than the usual signs of aging? In this 15-minute exploration, we'll guide you through 7 must-know early warning signs that an elderly family member or dear friend could be nearing their final year of life, helping you to recognize these indicators with clarity and compassion. By understanding these signals early on, you can plan thoughtfully, advocate effectively, and ensure their comfort and dignity throughout this delicate period. The first warning sign to observe is a persistent and notable decline in physical strength and mobility that exceeds the expectations of normal aging. While it's common for seniors to experience gradual changes in balance or muscle tone, when you see them hesitating at the bottom of the stairs, gripping railings more firmly than before, or using furniture for support on even level ground, this may indicate that their musculoskeletal system is losing resilience at an accelerated pace. These physical setbacks often manifest in small but meaningful ways. Perhaps they once rose from a seated position without effort, but now pause and shift their weight, using their arms to push up. You may notice them holding on to door frames or walls during short walks, or their gait becoming slower and more deliberate. Even slight tremors or unsteady steps should prompt your attention, as they can predispose seniors to falls that cause serious injuries and further weaken their bodies. Addressing declining strength and mobility requires a delicate balance between encouraging safe activity and respecting their comfort. Gentle, supervised exercises, such as seated leg lifts, slow arm raises, or short walks in a secure environment, can maintain circulation and muscle tone without overtaxing their energy reserves. Always offer rest breaks, avoid setting performance expectations, and consider consulting a physical therapist who specializes in geriatric care to design an individualized program that adapts to their changing needs. The second sign to watch is dramatic fluctuations in appetite and body weight. A sudden loss of interest in meals, skipping favorite dishes, or leaving significant portions uneaten can signal that something is amiss, whether medically, psychologically, or socially. Conversely, unexpected weight gain or unexplained swelling, especially around the ankles or abdomen, might be the first indicators of underlying organ dysfunction such as heart failure or kidney issues, both of which deserve prompt medical evaluation. When appetite wanes, seniors risk malnutrition and frailty, which in turn exacerbate weakness and susceptibility to illness. It's essential to track not only what they eat, but also the quantities and consistency of their weight. Losing more than 5% of body mass in a single month is significant, as is a sudden gain exceeding 2 to 3 pounds when no dietary changes justify it. Keeping a daily food and weight log creates invaluable data for their healthcare providers. Proactive nutritional support involves offering small, frequent, nutrient-dense meals that appeal to their taste preferences. Collaborate with a registered dietitian to craft menus rich in protein, healthy fats, and colorful fruits and vegetables, and explore supplements under professional guidance if needed. Encourage adequate hydration through flavored water, broth-based soups, or hydrating fruits, while monitoring for signs of dehydration, such as dry mouth, confusion, or reduced urine output, which can have serious consequences in seniors. The third warning sign emerges when minor health setbacks lead to disproportionate medical complications and repeated hospital visits. A simple urinary tract infection, a bout of pneumonia, or even a sprained wrist may evolve into extended hospital stays, mirroring a body losing its capacity to bounce back. Each admission exacts a toll on their physical and emotional reserves, setting the stage for a cycle of decline that can be hard to interrupt once it begins. As hospital readmissions accumulate, recovery times lengthen and treatments become more complex. You might notice that they come home weaker than before, requiring additional home care or rehabilitation services. These setbacks can also trigger fear and anxiety in seniors, making them more reluctant to attempt even minor activities. Documenting each medical event, including diagnoses, treatments, and any complications, arms you with a comprehensive history to share with doctors who can adjust care plans accordingly. Engaging with palliative care specialists early on can shift the focus from aggressive interventions to comfort and quality of life. Palliative care addresses physical symptoms, emotional needs, and spiritual concerns, offering holistic support that benefits both the elder and their caregivers. Advocating for these services doesn't mean giving up hope. It means prioritizing dignity, effective symptom management, and personalized goals that align with your loved one's values. The fourth warning sign encompasses cognitive decline and episodes of confusion that go beyond ordinary forgetfulness. While misplacing keys or forgetting an acquaintance's name can be benign with age, repeatedly getting lost in familiar surroundings, failing to recognize close friends or relatives, or asking the same question within minutes should trigger concern. These behaviors suggest that underlying neurological changes, such as advancing dementia, Alzheimer's disease, or vascular cognitive impairment, may be at work. Memory challenges often co-occur with alterations in judgment and decision-making. You might observe that they leave the stove on after cooking, neglect medications, or fall prey to telephone scams. Such lapses not only endanger their safety, but also heighten caregiver stress. Compassionate patience and structured routines become vital, simplifying daily tasks, using alarmed pill dispensers, placing large print calendars in visible locations, and labeling drawers can mitigate confusion and help them navigate their day more confidently. Professional evaluation by a neurologist or geriatric specialist is crucial once you recognize persistent cognitive changes. Early diagnosis can open the door to treatments that may slow progression, as well as resources for coping strategies and support networks. Brain-healthy activities like puzzles, music therapy, or seated exercises that combine movement with memory tasks can stimulate neural pathways, while regular check-ins prevent isolation and ease anxiety for both the senior and their family. The fifth warning sign is social withdrawal and emotional distress that signal more than just a change in preference. When someone who once loved family dinners begins to decline invitations, or a lifelong hobby loses its appeal, they may be struggling with depression, grief over loss of independence, or a deep-seated fear of what lies ahead. These emotional shifts can intensify physical symptoms, creating a feedback loop that accelerates decline. Depression in seniors often goes unrecognized because its symptoms, low energy, reduced appetite, sleep disruptions, overlap with physical illnesses. Yet, untreated emotional distress can sap motivation, reduce immunity, and undermine treatment adherence. Engaging your loved one in gentle conversation about their feelings, validating their anxieties, and expressing genuine empathy can break through the isolation. Simple gestures, a shared cup of tea, listening without judgment, or bringing in a beloved pet for comfort, make a profound difference. If mood changes persist or worsen, professional mental health support tailored to geriatric needs becomes essential. Therapists specializing in late-life issues can offer cognitive behavioral approaches, reminiscence therapy, or guided relaxation exercises. Sometimes carefully managed antidepressant medication complements these therapies, always under the supervision of a physician aware of the senior's overall health context. The sixth warning sign to observe is increasing reliance on caregivers for basic activities of daily living. Tasks that were once routine, bathing, dressing, toileting, even feeding, may become overwhelming or unsafe for your loved one to perform alone. While accepting help can feel like a blow to their independence, these changes indicate that additional support structures are necessary to maintain their safety and dignity. Showering or climbing into a tub poses a real fall risk when strength wanes. Struggling to fasten buttons or zip zippers can frustrate and discourage seniors from wanting to dress themselves. Install grab bars, use shower chairs, choose adaptive clothing with Velcro or magnetic closures, and consider bedside commodes if necessary. Involving an occupational therapist can help identify modifications that preserve as much autonomy as possible. When caregiving demands surpass what family members can reasonably provide, explore reputable in-home care agencies or adult day programs that offer supervised activities and socialization. Transitioning to a supportive living environment does not mean abandoning your loved one. Rather, it ensures they receive professional assistance while freeing family caregivers from burnout. Such decisions, made collaboratively and with empathy, reinforce the senior's self-worth and safety. The seventh warning sign centers on persistent sleep disturbances and altered energy patterns that disrupt daily life. Occasional restless nights are normal, but chronic insomnia, reverse sleep-wake cycles, or prolonged daytime napping may signal underlying conditions like pain, medication side effects, or neurological changes. Poor sleep compounds fatigue, impairs cognition, and heightens emotional reactivity, making recovery and engagement more difficult. Assess their sleep environment. Is the room dark enough at night and free of distractions? Do noise levels, room temperature, or bedding comfort interfere with restful slumber? Encourage calming pre-bedtime rituals such as soft music, gentle stretches, or a warm, caffeine-free drink. Limiting daytime naps to short intervals and exposing them to natural light in the morning helps reinforce circadian rhythms. If sleep problems persist, discuss them with their physician, who can review medications and evaluate for sleep disorders such as sleep apnea or restless leg syndrome. Non-pharmacological approaches, like cognitive behavioral therapy for insomnia or CBTI, have demonstrated efficacy in seniors and avoid the risks associated with sedative medications. Recognizing these 7 warning signs, declining mobility, appetite and weight fluctuations, medical complications, cognitive changes, social withdrawal, increased dependency and sleep disturbances, equips you to take proactive steps that honor your loved one's preferences and preserve their quality of life. Early awareness creates room for meaningful conversations about their goals, fears, and values while they remain engaged enough to articulate them. Initiating discussions about advanced care planning and directives can feel daunting, yet it is one of the greatest gifts you can offer. Frame these talks around their life story. Ask about their proudest moments, cherished memories, and personal definitions of comfort and dignity. Documenting these wishes in writing, whether through living wills, durable power of attorney for healthcare, or post forms, ensures their voice guides future decisions when they may no longer be able to speak for themselves. Caring for a loved one in their final year also means caring for yourself as a caregiver. The emotional, physical, and logistical demands can lead to stress, exhaustion, and compassion fatigue. Build your support network by connecting with friends, family, or caregiver support groups. Schedule respite breaks, delegate tasks, and consider professional counseling if feelings of overwhelm or grief become too heavy to bear alone. Collaboration with an interdisciplinary team, including doctors, nurses, social workers, therapists, and spiritual advisors, ensures a holistic approach to care. Keep detailed logs of symptoms, medications, mood changes, and incidents that concern you. Sharing this information at care team meetings or during home visits enhances decision-making and can catch subtle trends that inform timely interventions. Above all, remember that each individual's journey is unique. While these signs outline common patterns, your loved one may exhibit them in different sequences or intensities. Approach every observation with openness, avoiding assumptions or premature conclusions. Treat each day as an opportunity to connect, listen, laugh, and honor the person you cherish. Thank you for joining us in this compassionate guide to recognizing the early warning signs that your elderly loved one may be nearing their final year. If you found value in these insights, please share this video with others who might benefit, give us a thumbs up, and subscribe to our channel for more heartfelt guidance on senior care. Your support helps us continue creating content that nurtures understanding, respect, and dignity for seniors everywhere.